Medical Coding Test Preparation Practice Exam and Study Guide, 25 Hardest Questions. Question 1. A patient is diagnosed with a displaced fracture of the neck of the left femur, initial encounter. What is the correct seventh character for the code? A, D, S, K. The seventh character is used for the initial encounter while the patient is receiving active treatment for the fracture. Question 2. When coding for a biopsy followed by a complete excision of a skin lesion during the same session, how should it be coded? Code both the biopsy and the excision. Code only the excision. Code only the biopsy. Code the excision and add modifier -51 to the biopsy. According to CPT guidelines, if a biopsy is followed by a more definitive procedure like an excision at the same site, only the excision is coded. Question 3. Which ICD-10-CM chapter is used for coding factors influencing health status and contact with health services? Chapter 1, Chapter 20, Chapter 21, Chapter 18. Chapter 21 contains Z codes which represent factors influencing health status. Question 4. A patient has hypertension and chronic kidney disease, CKD, stage 3. How should these conditions be coded? Code them separately with no relationship. Use a combination code from category I-12. Code the CKD only. Code the hypertension only. ICD-10-CM assumes a relationship between hypertension and CKD. A combination code from category I-12, hypertensive chronic kidney disease, should be used. Question 5. What does the instruction "use additional code" mean in the tabular list? The code is optional. You must code another condition to provide a complete clinical picture. You cannot use this code with any other code. The code should be listed first. Use additional code is a mandatory instruction to sequence a second code to provide more detail. Example, identify the bacteria in an infection. Question 6. In CPT, which of the following is considered part of the surgical package? Preoperative office visit the day before surgery. General anesthesia provided by an anesthesiologist. Routine postoperative follow-up care. Diagnostic tests performed weeks before surgery. The CPT surgical package includes the actual operation, local infiltration, and routine follow-up care, global period. Question 7. A 45-year-old patient undergoes a screening colonoscopy. During the procedure, a polyp is found and removed by snare technique. How is this coded? Coding only the screening colonoscopy. Coding the colonoscopy with snare polypectomy. Coding both a screening and a surgical colonoscopy. Coding a biopsy only. If a screening procedure turns into a diagnostic/surgical procedure, the surgical procedure, snare removal, is coded. For Medicare, a modifier may be needed to show it started as a screening. Question 8. Which modifier should be used when a physician performs a procedure that is mandated by a third-party payer? -22, -32, -52, -25. Modifier -32 is used for mandated services, such as those required by an insurance company or official body. Question 9. What is the correct way to code for sequela of a previous injury? Code the current problem first, then the original injury with S as the seventh character. Code only the original injury. Code the original injury with A as the seventh character. Sequence the S code first. For sequela, the condition or nature of the sequela is sequenced first, followed by the injury code with an S in the seventh position. Question 10. In ICD-10-PCS, what does the root operation describe? The body part being treated. The objective of the procedure. The approach used to reach the site. The device left in the body. The root operation, the third character in PCS, defines the specific objective of the procedure, example resection, excision. Question 11. A patient is admitted for treatment of a complication from a previous surgery. What is the principal diagnosis? The condition that led to the original surgery. The complication code. The surgery itself. A Z code for follow-up. When a patient is admitted specifically for a complication, the complication is coded as the principal diagnosis. Question 12. What is code creep? Forgetting to code a diagnosis. The same as upcoding, inflating codes to get higher reimbursement. Using codes that are expired. Crossover between ICD-9 and ICD-10. Code creep is another term for upcoding, where codes are manipulated to increase the complexity or severity of the case falsely. Question 13. Which of these is a valid CPT Category 3 code? 99213, 00100, 0501T, A4253. Category 3 codes are temporary codes for emerging technology, services, and procedures. They end with the letter T. Question 14. A patient has acute and chronic respiratory failure. How should this be sequenced? Chronic first, then acute. Only acute. Acute first, then chronic. Only chronic. If both acute and chronic conditions are present and there is no combination code, the acute condition is sequenced first. Question 15. When a patient has a bilateral procedure but there is no bilateral code and only a unilateral code exists, how should you code it? Code it twice. Code it once with modifier -50. Code it once with modifier -51. Code it once and double the price. If the CPT code description is for a unilateral procedure, use the code once with modifier -50 for bilateral. Question 16. What does principal procedure mean in the inpatient setting? The first procedure performed. The procedure performed for definitive treatment rather than diagnostic purposes. The most expensive procedure. The procedure done in the ER. The principal procedure is one that is performed for definitive treatment or is most closely related to the principal diagnosis. Question 17. What is the CMS 1500 form used for? Inpatient hospital billing, professional, physician, office billing, pharmacy claims, dental claims. The CMS 1500 is the standard claim form used by non-institutional providers and suppliers for billing. Question 18. How do you code an impending condition that did not occur at the time of discharge? Code it as if it happened. Code the symptoms that led to the threat of the condition. Do not code it at all. Use a history of code. If a condition is impending or threatened but does not occur, code the underlying condition or signs/symptoms, unless there is a specific threatened code available. Question 19. What is the global period? The time a patient spends in the waiting room. The period of time during which all routine care related to a surgery is included in the surgical fee. The lifetime of a code. The time it takes to get an insurance response. The global period is a set number of days, example 0, 10, or 90 days, after a procedure where follow-up care is included in the payment for the procedure itself. Question 20. A physician performs an E/M service and a minor procedure. Both are supported by documentation. What must be appended to the E/M code? -51, -25, -59, RT. Modifier -25 is required to indicate that the E/M service was significant and separately identifiable from the procedure.